welcome to Community Health Group's HEDIS Tips for Success tutorial. We will show you the tools that CHG has available to you, and we will share some tips that are helpful to successfully meet your HEDIS goals. At Community Health Group, your success is our top priority, and we hope this video will be beneficial to reach your HEDIS goals. The first resource we'd like to show are our online HEDIS tools. We'll go over the steps to access these tools and obtain the data you need to meet your HEDIS goals. So let's dive in. Log on to www.chgsd.com. Select Providers. Then select Provider Access. Enter your assigned login and password. If you have trouble accessing any of this information or require online access, please feel free to contact our Community Service Department at 619-498-6457. We will gladly assist you and your staff. Click Login. Click on the HEDIS box with the plus sign symbol. This will open a new drop-down menu. From this menu, you will be able to view and extract your HEDIS opportunities reports, access to a HEDIS report card for your office, and access to our HEDIS reference guides. Click on the HEDIS web portal. It will automatically open a new window. You will see on this page that you have the ability to obtain the total number of HEDIS measures outstanding for your office, access to our HEDIS tutorials, the ability to view the outstanding measure details, such as the location, the CHG health plan ID, the member's Medi-Cal number, the member's name, product line, and measure description. You may also filter your view by the site on top. In order to save a copy of your report, click on the Create and Download Excel file with all missing hits. The output report has the following columns: the site name, member last name, member first name, the date of birth, HEDIS measure, line of business, their subscriber ID, and Medi-Cal ID. You have their demographics such as the address and phone number, Community Health Group's provider PCP number, and the assigned primary care physician, last name and first name. We have a few recommendations on how to format your report. Click on the Insert tab. Click on Pivot Table, and a pop-up will appear labeled Create Pivot Table. The first circle under Choose the data that you want to analyze should already be bubbled, and the table range should also be populated. Click on OK. A new blank worksheet will be created. On the right side of your screen, you will have a pivot table field list. We recommend you use the following fields: site name, measure, line of business, and carrier mem ID. Let's use measure so we can give ourselves an idea of how many members fall into each HEDIS measure for our office. Drop the measure field into the first box labeled rows. Next, drop the carrier member ID in the values area. Make sure to click on the arrow to choose the count of these members. Click on Value Field Settings, and under the Summarize Value field by, choose Count. We can now see the count of members that fall into each measure for your office. As you add fields to the pivot table, it will automatically start generating your customized reports. You may add or delete any columns, rows, and values as needed. Now, let's take a look at the HEDIS report card. Back on the provider web portal page, you will see a link to the HEDIS report card. Click on this link and you will have access to your scores for each HEDIS measure for both your Medi-Cal and CalMediConnect patients. The scorecard displays the HEDIS measures along with the minimum and high performance level benchmarks, your current score, your current rating, and the amount of members you need to close gaps for in order to reach the minimum and high performance level benchmarks. There is also a legend at the bottom to help identify where your office stands. Measures highlighted in green indicate you are at the high performance level. Yellow indicates you're at the minimum performance level. and red indicates you are below the minimum performance level. Now that we've seen how to use our online tools, let's go over some tips to help your staff meet their required HEDIS measures. Submit claims within 30 days of service. This will shrink the gap reports and members will fall off your lists. If you use an outside biller, make sure they're not stripping any codes for your encounters that they feel may not be reimbursable. Every visit counts. Complete initial health assessments and annual health assessments within the time limit. Remember, the time limit for Medi-Cal members is 120 working days and 90 working days for Medicare members. Ensure your staff records all immunizations into the San Diego registry, and that the first vaccine given at the hospital is also entered into the registry. We upload information from the registry to ensure your HEDIS gap lists are up to date. Fill out the CHGP form on CHG's provider web portal. Using this form helps close many HEDIS measures for children and adolescents. For the controlling high blood pressure measure, we recommend to take 2 blood pressures during a visit and document both readings in the member's medical record. Don't forget to let us know if the member has hypertension or not. For this measure, we need a yes or no answer in order to determine if the patient should be included in this measure. For the cervical cancer screening, it's important to document if the patient had a partial or total hysterectomy. A total hysterectomy could exclude this member from your gap list. Please remember to include OBGYN notes in the member's chart. Another tip is to do the HPV co-testing during a pap smear, which will ensure the member is compliant for this measure for 5 years. For the weight assessment, nutrition, and physical activity for children and adolescents measure, it is very important that the BMI percentile is documented, not just the BMI value. Documentation of physical activity does not count as a developmental milestone, but a check on this box on the CHGP form will ensure the member is compliant. If your office utilizes an electronic health record program, let us know if you're willing to provide access for community health group to log in remotely. With access to your EHR, we can log in and confirm that members have been seen by your office and research missing HEDIS gaps in care. Contact us directly for more information. If you have any questions or need any additional assistance, please feel free to call us.
Hello, my name is Vanessa.
And my name is Robert. We're part of the Community Service Department.
If you need assistance with the web portal, please give us a call.
Our number is 619-498-6457.
Thank you.
Thank you.
Hi everyone, my name is Gabriela Rubalcaba and I'm the HEDIS manager. If you have any questions regarding the Medi-Cal line of business HEDIS measures, feel free to give me a call at 619-498-6535. Thank you.
So there you have it. We really hope this video will be a useful tool to help you succeed with your HEDIS rating. Please know that Community Health Group is heavily invested in your success. Thank you so much for watching and have a great day.